How is tangentiality diagnosed? Have you ever found yourself in a conversation where the other person seems to drift off topic, leaving you confused? This can be a sign of tangentiality, especially in the context of schizophrenia. So, how exactly is tangentiality diagnosed? Let's break it down. Tangentiality is a disturbance in thought processes. It occurs when a person's speech or responses stray from the main topic or question. Instead of staying on point, the conversation veers into unrelated or loosely related subjects. This makes communication ineffective and hard to follow. In schizophrenia, tangentiality is a type of thought disorder, showing disorganized thinking that disrupts coherent conversation. Diagnosing tangentiality usually starts with a clinical assessment by a mental health professional. During a psychiatric evaluation, the clinician carefully observes the patient's speech patterns. They listen for responses that wander off topic, fail to answer questions directly, or include excessive irrelevant details. It's important to differentiate tangentiality from other speech issues. For example, circumstantiality involves someone eventually returning to the topic, while derailment sees thoughts jumping abruptly between unrelated ideas. Tangentiality is unique because the speaker does not return to the original topic once they have deviated. The broader clinical context is also considered. The presence of schizophrenia or other psychiatric conditions known to involve thought disorders is crucial. Tangentiality often appears during acute psychosis or phases of disorganized thinking. Its presence can support the diagnosis of schizophrenia or related disorders. Mental health professionals may use structured clinical interviews and mental status examinations. These tools help evaluate thought content and processes. The clinician assesses whether the patient's speech shows signs of disorganization, like tangentiality, which is a hallmark of schizophrenia thought disorder. Another key step is excluding other causes that might produce similar speech patterns. Conditions like high anxiety, dementia, delirium, or brain injury can also lead to tangential speech. However, the diagnosis in schizophrenia relies on the overall symptom profile and patient history. In practical terms, diagnosing tangentiality helps clinicians understand the severity of thought disorders. This understanding guides treatment decisions. It may indicate the need for interventions that target cognitive and communication difficulties. These can include antipsychotic medication and supportive psychotherapy aimed at improving thought organization and social communication skills. So, to sum it up, tangentiality is diagnosed through careful observation of speech during psychiatric evaluations. It is distinguished from other speech abnormalities and placed within the symptom complex of schizophrenia. This diagnosis is vital for assessing the extent of thought disorder and tailoring appropriate treatment strategies.